Hi, hello everyone. My name is Chinedu Madike, and I am a manual osteopathic therapy student. Um, this is a visceral manipulation case study video. Beside me here is my client who is presenting with burning sensation in the chest. He's having difficulty swallowing, sometimes feeling like food is stuck in his esophagus. And you also have a persistent cough, especially at night, right? So potentially triggered by acid reflux or GERD, like we call it. So I'm going to start by getting consent from my client to do assessment and treatment. Do I have your consent?
Yes.
Okay. So first I'm going to start with general listening. So I want you to stand here and face that side. Okay, come close to me here. So I'm going to assess, do general listening, then proceed to local listening. So I'm going to place my right hand on your head, okay? Then my left hand at your back. I'm going to give a little compression on your head. I release my left hand. Then I slightly loosen my right hand. See. Okay. Sitting forward. Okay, now so it's tilting forward. So when I touch the stomach here, around here, he comes back normal. He falls back. So which indicates that something here. But I never know which one, but I have to do local listening. From there I will determine which viscera that is an indication. So I want you to lay on the table, face up. So I'm going to perform local listening. So I'm going to start by placing my hands on pubic bone, gently, no pressure, very gently. Or you can ask your client to show you his or her pelvic bone. Pubic bone. So there, you sink, you listen with your hands, concentrate, and listen, very gentle touch. No pushing, no pressure. There you go. I'm also looking for where my hand will be pulled to and what is pulling. So I listen with my hands. Okay, I think I'm being pulled to the right side, the left side, stomach. Stomach is pulling my hand. Okay, so to determine that, I'm going to also place my left hand on the liver. So if the liver disappears, then I will know that it's the stomach. Oh yeah, here we go. It disappears. So now we know we are treating the stomach. So we're gonna start your treatment. So to treat the stomach, I'm going to start with motility. Let's start with motility. So I'm going to place my hand, or I use the other way around so everyone can see my hand. So I place my hand very gently on lower rib cage, like 5, 6, 7 ribs. Gently place my hand. I can as well rest my forearm on the abdomen. I am not applying any pressure. The thumb is on the projection of the pylorus. So motility is addressed indirectly by following the unimpaired movement. So the thing is that where does he want to go? And where does he want to go? Okay. So if he wants to go superior, medial, because he goes from medial to lateral. That's how the movement is supposed to be in motility. So we're actually looking for that movement. So I may also try to increase the range of free movement. It's called induction, and then see if the limited movement direction improves. So I'm going to repeat this several times until the motility has returned in normal terms of the rhythm. So direction and magnitude. Okay. Okay, so after that, I'm going to also do the Chapman reflex. So the Chapman reflex, as we know, the stomach, the Chapman reflex of the stomach is on rib 5, 6, and 7. So to locate 5, 6, and 7, we can go to the clavicle. Under clavicle, we see rib 2, 3, 4, 5, and 6, and 7. So between 5 and 6, right here, between rib 5 and 6, like the intercostals muscle. So we're just looking for a lesion or hard tissue there. If you find any, just give it rub. Rub there. Any discomfort? Any pain? Any pain? Okay. So we come between 6 and 7. Check. Okay, so then posteriorly, we also have Chapman's reflex. So I want my clients to lie prone. I want you to lie on your stomach. Remember, it's on the left side. I want this hand here. Okay. So we're going to treat rib 5 and 6 and 7. So I can come here and find my 4, 3, 2, 1, 12, 11, 10, 9, 8, 7, 5, 6, and 5. So it's in between the transverse process of rib 5 and 6 and spinous process of 5 and 6 and transverse process of rib 5 and 6. So in between SP and TVP of 5 and 6. So we rub, gently rub, gently rub. Okay, so we rub. We're looking for any hard tissue or lesion, so we can release. Yeah. Okay, so I'm going to ask my client to turn over, lie on your back. Okay, no, face lie, yeah, like that, face that side, and we are going to do treat mobility of the stomach. So mobility of the stomach is when the body moves, the viscera move as well. So with my right hand, I place on the rib 5, 6, and 7. So I ask my client to put his hand forward. My right hand, rib 5, 6, and 7. My left hand on the abdomen. So I'm going to hold. So I'm going to be, my right hand will be coming laterally, while the left one goes posteriorly. So it's like I am opening up the space. Okay. So I'm going to use my right hand to press the ribs 6 and 7, or 5, 6, and 7 into the stomach, and use my left hand and to pull the abdomen laterally. So I'm going to hold it for a while and wait for the tissue to unwind. Okay, so that is the mobility of the. So the next thing I'm going to treat is the oscillation of the stomach. Oscillation of the stomach. I'm going to ask my client to face up. So the oscillation of the stomach, because he's having acid reflux, we're going to try and press down the stomach and to see if the gas can escape and everything will fall in place. To start with, I'm going to use my fingers and I'm going to put it on the stomach, supporting it with my left hand. So what I'm going to do is I'm going to sink in. Sink in. Are you okay?
Yeah.
So I'm going to place my both fingers on the stomach and apply posterior pressure until I am in clear contact with the stomach wall. So I will be pressing lightly and intermittently at about a rate of 150 to 180 per minute. So I can continue doing this for like yeah, 2 minutes, then I'll release. Then we are going to, the next thing we are going to do is we are going to perform another treatment, and this treatment is called we are going to stretch the lesser omentum. Stretching the lesser omentum. Put my right hand, find the abdomen, my right hand and my left hand this way, this one here. So what I'm going to do is I'm going to slightly to the left of the median line below the xiphoid process. Okay, yeah. So with my 4 fingers close to each other on top of the stomach wall, then I place the hand on the medial line next to the right hand. Okay. Then I'll use the 2 hands to apply gentle pressure posteriorly into abdominal cavity. I must go cautiously to reduce fascial tensions in this location. So I will gently draw the both hands apart laterally to extend the smaller omentum. Then I will hold this stretch, pull steady for up to 1 minute. Okay, so I'm going to ask my client to lie on your side line, and face that side. So at the next treatment I'm going to perform is I'm going to mobilize the mediastinum to improve esophageal mobility, because there is a boundary between the esophageal and the stomach. So from there, the gas is escaping to the esophageal. So what I'm going to do is I'm going to place my left hand on the sternum, lower sternum, then my right hand too. So I'm going to place my left hand flat on the lower third of the sternum, and my right hand rests on the upper TSCs. Spinous process is near the manubrum sterni. So I place my hands there. So what I'm doing exactly is my left hand will be pulling inferiorly, while the right one pulls superiorly. So I will apply pressure while the right one is going superiorly and the left one is going inferiorly. So we hold it for a while. the things begin to unwind, then you can do it. So, and so that will be all for now. So I want you to. So I want you to know that from my assessment, I think you eat late night food. That's one major cause of acid reflux. So yeah, so you should minimize eating late and get enough sleep. Okay. Thank you very much.